Now, it's again very important how you manage these cases of epileptic seizures and this seizural activity. When you get these patients, you must know that the management basically starts off right from the history taking in detail, and then you move on to the physical examination for the particular patient, and that is basically going to give you the particular criteria how you're going to treat the patients individually. Over here, you must know that the management of epilepsy starts off with the adult patient, either if he's having a seizure. The history is very important. You're going to take the history in detail. Then you're going to move on to the physical examination in the particular individual. You exclude the syncope, and then you move on to the transient ischemic attacks. You're going to highlight all of these features over here. The migrainous activity is also going to be taken into account, and then you move on to the acute psychosis or the other causative factors of the episodic cerebral dysfunctions that you're going to focus on in the history taking. The history of epilepsy currently treated with the anti-epileptics. So it's again very important that you focus on the fact that what are the peculiar histories over here, and has the patient been on any anti-epileptics previously or not. So this is what you're going to focus on over here. Then moving on, whether the patient has any previous, if the patient has no history of epilepsy, you have a separate approach. And if the patient is an already diagnosed case of epilepsy, you have an entirely different approach over here. So the assessment starts off if he or she is a diagnosed case of an epilepsy, the adequacy of the anti-epileptic treatment. So it can be the case that you have to either increase the dose of the anti-epileptics, or even you can resort to decreasing the dose of the anti-epileptics if that is needed. The side effects of the anti-epileptics itself are going to be taken into account over here. And in a lot of patients, you're even going to ask for the serum levels of the different enzymatic reactions over here. Then moving on, if there is no history of epilepsy, you're going to resort to and find out what is the underlying pathophysiology in this particular case over here. The complete blood counts are taken. Then you are also going to focus on the electrolytes, calcium, magnesium, serum glucose levels, and liver function tests as well as the renal function tests are taken into account. Then moving on, we have the urine analysis and the toxicological screening, which is done for the patients as well. We are going to look for the fact that if we assess the patient and already on anti-epileptics, and we're going to look for the enzymatic reactions. Then you're going to look for the investigations again. Complete blood counts are called for. You look for the electrolyte imbalances, calcium, magnesium, serum glucose, LFTs, as well as the renal function tests are advised over here as well. Along with that, you look for the urine analysis and the toxicological screening as well. So this is how you're going to evaluate whether the patient is under the effect of any other toxic drugs or not. These are all the management guidelines, which are basically, as you can even evaluate over here, separate for a patient who's already diagnosed and is on anti-epileptics, but he or she is still having the uncontrolled seizure activity. One thing that I would like to emphasize over here is that being on anti-epileptics doesn't completely control the seizures. The patient still is going to have the seizure activity, but it is going to be in a controlled state. So the history is very important over here. You're going to look for the fact whether the patient is in an improving condition, or either the patient is not responding to the treatment at all. So evaluation is very important over here in this particular state of epilepsy. In a case where the patient doesn't have any history of epilepsy and you had run all the tests that are considered for the patient, the positive metabolic screens or the symptoms that are suggesting a metabolic disorder are also taken into account over here. Then a negative metabolic screen is also taken into account, and we'd had separate approaches for both of them. If there is a negative screening, then we are also going to run for the MRI and the EEGs in that particular patient. And in a patient in which there is something positive found out, we're going to further work up with the lumbar puncture And we're going to carry out the cultures on the CSF, the endocrine studies, and move on with the CT scans. The radio imaging techniques are also to be resorted over here, particularly the CT imagings and the magnetic resonance imaging over here. Over here, you can even evaluate after carrying out the particular testing techniques. We're going to move on having different approaches in a patient who has the normal studies, and on the other hand, the patient who has the abnormal studies for the preliminary tests. In a patient who has the normal studies, we're going to move on with the subtherapeutic anti-epileptic levels, and then we can have the therapeutic anti-epileptic levels as well. We have separate approaches for both of these patients. In patients in which we are considering the subtherapeutic levels, we'd increase the dose or we'd resume the doses in the particular cases. In patients who have therapeutic anti-epileptic levels, we'd increase the epileptic therapy to the maximum tolerated doses. So this is how you basically move on by the trial and error basis in these patients who are responding to the anti-epileptic therapy in a distinctively different manner. Having the abnormal tests, we treat the identifiable metabolic abnormalities, whatever the causes. After these lumbar puncture and the cultures are taken, we're going to treat the underlying metabolic abnormalities and consider the anti-epileptic therapy in the patient. After conducting the MRI and the EEGs, on the other hand, if there are the focal features of the seizures, we're going to resort to the focal abnormalities particularly. If the case is yes, if it is a yes and there are any focal features seen in the patient, you're going to look for the mass lesions, any evidences for stroke, or either it can be the underlying meningitis or encephalitis that are contributing towards the development of the seizure activity. Treating the underlying cause is very important over here, and basically you move on whatever the cause is. Either it can be the tumorous condition, the paraneoplastic syndromes, or either it can be the infectious states. So whatever the cause is, you're going to treat the underlying cause, and that is going to improve the condition in the patient. You consider the anti-epileptic therapy coupled up with whatever underlying cause and the particular treatment for that underlying cause as well. If there are no focal features seen and there are no focal abnormalities, it is considered to be a case of idiopathic seizures, and you again will be considering the anti-epileptic therapy and would move on with the trial and error basis in the particular individuals. What are the drugs of choice? What are the treatments of choice? It's again very important that you treat the underlying conditions. If it's a metabolic abnormality, you're going to deal with that accordingly. If it's an infectious state, you're going to deal with that particular infectious state. The avoidance of precipitating factors, the environmental factors, the triggering factors are also going to be taken into account. The anti-epileptic drug therapy includes the lamotrigine. We have valproic acid, zonisamide, phenytoin, carbamazepine, oxcarbamazepine, topiramate, phenobarbital, and primidone is one of the drug of choice. Then we have the felbamate. So these are the list of drugs that can be evaluated, and it's sometimes an individual case. In basically, you go with the trial and error basis and look how the patient is responding to this anti-epileptic treatment. All of these drugs have their adverse effects, and you have to take into account for that particular individual and manage accordingly.